Welcome to Motherhood. Whether you're 18 or 80, Dr. Christina Hibbert, clinical psychologist, author, and mother of 6, is here to help you through the ups and downs, the joys and frustrations, the new information from experts, and the stories of happiness and heartbreak from real moms. Remember, if you can, tell your mama to listen too.
And I'll make everything all right.
Here's Christy.
Welcome to Motherhood. It's me, Dr. Christina Hibbert, here to help you overcome, to become, and to flourish in this challenging experience we call motherhood. Boy, if there's one thing that makes motherhood extra challenging, it is when you have children who are struggling with a medical illness or developmental delays or special needs. And today, this show is going out to all you moms out there who are doing it every day, who are taking care of your children with these medical or developmental challenges. And on top of just how hard motherhood is in general, you have all these extra stresses. And so today we hope to help you, and this really for all moms, even if you're not dealing with this at this point, you never know when you could in the future. And the things we'll talk about today hopefully will just take some of that stress off and help you know how to deal with all the emotional challenges that come with raising special needs children, and with how you can manage yourself during all of this caregiving that you have to give on top of the regular caregiving that you give as a mom. So I will be introducing our fabulous guest in just a moment. And before we get started, as always, I just want to thank you for being here on Motherhood. And I hope you'll visit my website, drchristinahibbert.com, for resources on the things we talk about today, all kinds of great free goodies there. And you can find us on YouTube as well. Don't forget that if you'd prefer to watch the video version, you can go and look up on YouTube, Dr. Christina Hibbert. We even have a playlist of Mother TV episodes, and you can subscribe, and whenever a new episode comes up, it'll notify you. So that's pretty great. And of course, I hope you are finding us on iTunes, if you have an iPhone, that is, or Apple device, and you can subscribe there as well, but you can also find us through my website. And of course, join our Facebook group, Growing Through Motherhood. So everybody's welcome. Just go ask to be added, Growing Through Motherhood. We'd love to have you there as well. Now, as I was thinking about today's topic, one of the clients that I've worked with came to my mind right away. Excuse me, I'm having some froggy voice issues. See, I'll probably just cut this out.
Okay.
Like there's something totally caught me. Okay,
Yeah.
Here we go. Okay. So one of my former clients came to mind, and she actually started seeing me through a support group I was doing for pregnant and postpartum moms who were struggling with depression and anxiety. And she came to us with she had just had her 5th baby. So she was, pretty overloaded. She had a lot of children, and her older children had some special needs. Her oldest son had pretty intense ADD that she was trying to figure out with medications. And she had a couple of children one that had a lactose intoleration, or actually an allergy. So she had to completely be off anything lactose. And then another one that had a gluten allergy that had to be completely off glucose. And she had this baby, and of course she was, feeling overwhelmed, and the baby was beautiful. And as this baby grew, they started to notice that there were probably some developmental delays. And it wasn't until she was over a year old and she really hadn't hit a lot of her milestones that they discovered that she had a very rare, very, very rare disease that would affect her development physically and mentally, cognitively. And at the same time, they found out that she also, part of her delay was that she was severely allergic to all kinds of things as well. And so in addition to having these older children with different diets, this baby had to be on, I guess it was like a ketogenic type diet, but really, basically she had to eat lard, fat, grease, butter. The things that we think of as healthy actually were deteriorating her muscles. And so she had to eat all of these things that the rest of us would probably clog our arteries eating. And so this poor mother was not only overwhelmed by having 5 children just to take care of, but she had these developmental issues that required a lot of attention and physical therapy, plus her older children who needed attention, plus now 3 children with completely different diets, and trying to cook for a whole family with all these different diets. And I just thought, wow, how do you even do that? How do you even keep up with that? I mean, I can barely feed my large family, and that's just because they don't like the food, right? But then throw in there that they really can't have it or it's going to make them sick. These are all things that we deal with as moms, and some of us and some of you out there have more than your fair share. And we're here today to empathize and to understand better. And we have a fabulous expert who's not only a psychologist, but also has personal experience in this. And so without further ado, let me go ahead and welcome our guest. So today we have with us Dr. Erin Joyce. Erin, welcome to Motherhood.
Thank you so much. I'm so happy to be here.
I'm so happy to have you here. Erin and I met up a few weeks ago at a course that I was teaching up in Utah, and I'm so glad that you decided to come on the show because we only talked a little bit about some of your experiences, but I know this is such an important topic, and so many of our listeners are out there struggling right now.
Yes, definitely. No, I mean, just hearing your story about your client, it comes in so many different forms.
Yeah.
These special needs.
Yeah, absolutely. So today, everybody, we are going to talk a little bit with Dr. Erin Joyce here. But before we get into that, let me introduce you to her a little bit. So Dr. Erin Joyce is a licensed clinical psychologist. She has a private practice in Los Angeles, and she works with individuals and couples and specializes in women's mental health throughout the lifespan, including pregnancy and postpartum. One other interest of hers is coping with the challenges of having a child with a medical illness and developmental delays, which is exactly what we're talking about today. And, she knows what she's talking about because she lives with her husband and 3 children in LA. And you can find out more about Dr. Erin Joyce at her website, which is Dr. Dr. Erin, E-R-I-N, Joyce, J-O-Y-C-E, drerinjoyce.com. All right. Awesome. Let's get started.
Thank you. Thank you. Yes.
So you proposed this topic to me because, you have some personal experience. Let's just, if you don't mind, just kind of like briefly throw out there how you got involved in this as a specialty, because otherwise you work in, women's mental health and pregnancy and postpartum, but this is kind of near and dear to your heart.
Yes, exactly. Definitely very near and dear to my heart. And I'm pretty new at it because my son is 2.5 years old, but when I was pregnant, and actually my son is a twin, so I shockingly found out I was pregnant with twins.
Yikes.
And then another huge shocker at when I was just 16 weeks along, found out that one of my boys has a heart defect. So and at the time, we didn't quite know exactly, kind of knew what it was, but didn't know how severe. And so there was a lot of, just a lot of shock and a lot of, obviously anxiety just about all the, unknowns and so many things, so many different thoughts and emotions. And I still had, most of a pregnancy to go through.
Wow.
So.
Wow. And twins. Hello.
And twins too.
And
right.
Did you already have another one before? So
yes.
So
who was just just about 19 months. They're
yikes.
19 months apart. So yes.
Yikes. Talk about being thrown into the fire, right?
Yes.
So he's been through lots of procedures, surgeries, these kinds of things?
Yes. So he's had three procedures, and one of them was an open heart surgery. So, and that was when he was, they came actually 2 months early. So then there was the whole prematurity thing as well, which complicated things.
Gosh.
But he was basically in the hospital for the first 4 months after he was born. And during that time, he had an open heart surgery because the other procedures they had done didn't fully address the issue that he had. It was with his aortic valve. And that started worsening. So they had to do kind of a more invasive, kind of more extreme surgery. But fortunately that went as well as we could have hoped. So, so very grateful for the medical care that we got.
And so he's 2. Your twins are 2.
They're 2.5.
2.5. And then you have what, a 4-year-old? Or
she
5?
just turned 4.
4?
Just turned
Okay.
4. Yes.
Okay. So you still got 3 little ones. And how is your one doing then?
So
physically?
Yeah. So, I mean, he's a pretty, a pretty remarkable little guy. He, I think, overall is doing as well as we could hope, given the challenges that he has, or the medical condition that he has. Really, I think our main challenge is feeding. So that's something that actually, maybe didn't fully anticipate or, imagine that would be an issue with a child that has a heart defect. But it's actually very common that these children have feeding issues for various reasons. And so that's actually been kind of the most challenging thing. He has a feeding tube, which a G tube, and that has actually been a godsend and something that, and it's just amazing how your perspective can change. When I first heard that could be a possibility, I, was like, oh no, I never want that to happen. And now I am so grateful we have it, because it, when he's not taking as much in by mouth, we have that as a backup. So he can get the nutrition and that he needs to grow. So, but I think he's thriving. I mean, he's really coming along. So,
wow. Well, I'm so glad to hear that. And how
thank you.
It's got to be an extra kind of interesting experience having twins, where one is the one that has the health issues and one doesn't, right?
Yes.
And seeing them kind of together, and I'm sure that presents its own kind of challenges. I'm sure we'll talk about that. But first I want to ask about, you kind of alluded to, but from your own experience and from your work and what you've seen with other parents, let's talk about some of those emotions, that emotional roller coaster. I mean, we both specialize in postpartum, and you're already on an emotional roller coaster just having a baby, but then you have all of these other challenges going on right from the start. What do you see as being some of the most common emotions that parents experience?
Yeah. Very intense emotions. Just a lot of, it rocks your world, finding this out. And, I think so normal to kind of go through a grieving process in a way, or all those emotions, because it really is this, you can think of it as a loss of this vision that you had of, having a healthy child, or, one that doesn't have these, additional things to deal with. So there's that. And, with any loss, you have the, there's the shock, there's the denial, there's anger, why me? Why did this have to happen? There can even be some self-blame, did I do something, to make this happen? Or, and then, just a lot of, sadness and anxiety about, what's to come. So it's,
a real mix.
It's a real mix.
You said something important too that I think we need to point out. You said with any loss. And a lot of times, we both know this, but a lot of times we people do not identify the loss right away, because thank goodness they're alive. Yes, they have these challenges, but they're alive. So it should be a happy, joyful thing that at least they survived, or they're surviving, or whatever it might be. But it is still a loss. It's like a paradox, really.
Yes.
Yeah.
Yes, very much. Right. And then you can feel guilty kind of, for if you, that you're not feeling, oh, I should be feeling grateful and happy that they're here with us. And it could be so much worse, but it's so normal. Just, you can have all of these kind of conflicting emotions, even all at the same time. And,
well, it
can be confusing.
Well, and that's why I like that you said loss, because to me, all those symptoms are like symptoms of grief, really, it's like, there is grief at the same time as you're trying to continue to have hope and be grateful and all those other things. And that's kind of what grief is anyway. You're trying to kind of carry on with life. But even, we can have these major losses, everybody listening, I hope you can see this and experience this. And sometimes it can be really helpful for someone to say, you know what, this is a major loss for you, that you didn't end up in the situation you thought you'd be in when you had your baby. And it's going to be a different road than you expected. And so it's almost like it's a loss of expectations, and it's a loss of maybe what you thought would be your quote new normal for life, or how you would mother, or how your child would be, or what they'd be able to do, and all of these things. And yeah, like Dr. Joyce was just saying, it's important to acknowledge those things, because then you can accept some of the feelings that come along with that, that it's normal to feel all of these range of emotions.
Right. Definitely. Give yourself permission to do that and not pile on the, self-judgment or self-blame that just, makes you feel worse.
Yeah. Right.
So,
right. So yeah, of course we have these myriad of emotions that you're going to experience, and that's all normal. So everybody listening, you can hopefully exhale a little bit, knowing that it's, perfectly part of the deal to just have this roller coaster going on. What are some of the, what are some of the challenges? What makes it so hard? We can always obviously guess. You're worried, you're afraid, all of these things are happening. But what are some of the common challenges that just that you might get caught up in when you're dealing with, let's say, from the baby phase, from starting when they're little, and finding out that they have some kind of a challenge that you're going to have to live with?
So yeah, I cannot emphasize enough, the importance of support and how helpful that can be. As much support as you can get from, variety of sources. Obviously, those closest to you, partner, siblings, parents, friends, and and I think it can be really helpful to get professional support if it just really seems like, okay, this is, these feelings are really overwhelming, or, feeling really overwhelmed, and it's not really getting easier. I think, professional help, it can be really helpful, and it doesn't have to be, it can be a time limited thing. Sometimes even just going once, you can feel better, or
like a place to talk, a place for support, and a place to learn how to cope with what you're going through. Totally.
And even just knowing, that you have, even just establishing that relationship with somebody that, okay, if you say, I don't really need to, feel like I'm okay right now, I don't need to, be seeing you on a regular basis, but just in case, because stuff happens down the road, as we know, we can't always predict, with a child that has an illness. So, so just so you have that in place can be peace of mind and just, a good idea.
Well, and I imagine, which we moms and women are not very good at, letting help in too, like practical help, like house cleaning help sometimes, childcare help, whatever it might need to be. Yes. Yeah. Definitely. Not feeling bad, not feeling guilty about taking the help, because it's so much. And I personally found it really helpful trying to seek out other families that have, had similar situation, had a child with, in my case, a congenital heart defect, and that, and nowadays with, social media like Facebook, there's so many, it's really easier to connect with these resources. So there's that, and just to feel like you're not alone, and also, it can be really just encouraging to, hear these success stories, or, obviously if you hear, you'll hear challenges and all that, but it's, it just makes you feel connected, like you're not alone in dealing with this. That's great. Those are all great pieces of advice, because I'm sure it's also challenging enough to just navigate the medical system, be an advocate for your child, all the things that you have to do, that we have to do anyway as parents and as mothers, but to the end, to a much more extreme degree in this case. Yes. Yeah. Right. It's on a different level. Right. Just probably more doctors, more frequent visits. And, and it's kind of like, it's almost like a part-time job, doing that, just managing all the doctor's appointments. And sometimes it's like, you really, need to be the one that, is kind of in charge, because doctors are busy, and, you need to remember, okay, they need a follow-up, or I need to check in on this and all that. So, definitely having a system of, trying to be organized, or getting some help with that is, I think, ultimately makes things less stressful. That's great. And I would add, and you're kind of alluding to this, but that you are the expert on your child. And it's hard to feel that when you've got experts telling you that you're wrong or something, but go with your gut feeling. Totally. Yeah. And that's actually, I'm glad you brought that up, because I think,
I think I'm more comfortable with that, with, and, don't make any, apologies about, okay, like, yeah, I'm the expert on my child and I'm going to ask, these questions. But yeah, in the beginning, I maybe didn't feel as comfortable doing that. And it's really important because you're with your child, all the time. And again, yeah, you really know them. And I really believe, and there is a thing like, this parental, instinct and all that. So never feel like you need to hold back. Or if you do, because sometimes doctors they're busy and they kind of, make you feel like, okay, they just want to wrap things up or just, do a quick check-in. Yeah. You have the right to try to then, to get your questions answered or to get your concerns addressed. So if that's going to another provider or somebody else in the, in the clinic or whatever, it's, yeah, this is your child. It's important, and don't feel bad about, about speaking up.
Yeah, that's great advice. And I hope everybody heard that, because I want to emphasize that to, feel free to get a second opinion. And that goes for your own mental health too. If you're trying to reach out for someone to work with or a counselor or support that way, to find someone who's right for you and not be afraid to keep looking until you find the right fit. Right.
Right. Definitely.
That's great. So, okay. So let's kind of wrap up with talking about self-care, because gosh, it's such a challenge anyway for moms and women. And we already feel guilty if we take care of ourselves instead of our children. But I mean, I can't even imagine when you have a sick child. I mean, I know how it feels when I have a sick child and I feel like I have to stay up all night making sure they're breathing or whatever it is. But when you really have a seriously ill or somebody, a child who's really going through those developmental delays to that more, intense degree, how hard it must be to feel like then you can take a moment to take care of yourself, but how incredibly important it must be.
Yes. No, totally. It's so important. And I think it does get easier with time, because I think you realize that I can't sustain this. Like, I can't be, as on top of things or as just, kind of like fresh, emotionally fresh or energized to, or physically, to deal with this if I don't take some time, time away just to take a break, to, and just focus on yourself and again, and re-energize, kind of, reboot. And then, I think for me, what helps is that I've experienced then, going back and being with my children and my, my special needs child, that I feel so much more, equipped and just, less stressed about things. So it's better for everyone. And then it goes back to the importance of really having the support. So, somebody that or more than just one person that you can trust, to be with your child when you're not there.
Yeah.
So,
and sometimes like a lot of times you can qualify for respite care, or, if you don't have that support, there should be other places to look, like, community resources, or that, like I said, medical resources like respite care, or faith community through a church or something like that, where you might be able to find the help that you might not have in your family, let's say.
Definitely. Yeah. And that's another
give you
thing.
A break. Yeah.
Yes, completely. And that just goes to really trying to find there's so many resources out there, and, just trying to, search out the ones that, that would be helpful to you and your family.
So everybody, and this goes for all moms, no matter whether you have a child with special needs or not, everybody, we all need to take a break. And it is good for all children to spend time with their other parent or other family members or a friend or whoever it is. That's good for them too, right?
Yes.
And like you say, we come back refreshed and they come back excited to see us, and it's a win-win. We're going to be able to be a better caregiver if we care for ourselves first. And as I like to say, it's not, it's not selfish. It's not saying like me first. It's saying me too,
Yes.
Like, I have to be well too. If I want to help my child be well, I have to be well too.
Right. You're thinking of yourself and them. It's
course. You do it for them, really.
Yeah.
And you might be, taking a nap or something and feeling like, this doesn't feel like I'm doing it for them, but really you are. You're doing it because you love your child. And it has perks too. I mean, it can feel nice to yourself too, but
and that's okay.
But very important to take care of your own needs and address your emotional needs. And I love that you pointed out, getting some therapy or counseling or mental health support just to help you cope with whatever you're going through can be really, really important. So let's kind of wrap up with the bigger picture then. Okay, this is a challenging situation. This is something that, we always think I hope that never happens to me. I hope my child never has to go through this, but there are definitely positives through everything we have to go through. There are lessons to be learned or things that we can gain. So what would you say are a couple of the takeaways that our listeners can take from today as far as some of the benefits that come from these challenging experiences of raising children with special needs?
Yeah, no, I think that's something that, like I say, like I would never willingly choose to kind of be in this club, but now that, you're in it, there are some pretty, remarkable, kind of profound, meaningful experiences, that you have that you wouldn't have otherwise. And I think the big one for me is just the perspective of, when you have a child like this that has faced these challenges and has these special needs, it's really, it helps you to just focus and reminds you of what's really important here in this, crazy life, busy day-to-day life that we lead. That all kind of falls by the wayside a little bit. And it forces you to, just really, focus on, kind of the simple things and the, which is, the health of your child and of your family and, just giving them the love and the support that they need. And, certainly that doesn't mean that you're, totally immune or that I'm like immune from all of the other daily stresses, but I think it's helpful to go back to have that perspective to go back to. And I'm really, I'm grateful that hasn't gone away because it was definitely there in the beginning, when you have a child that's fighting for their life. And so it's, it's easy to not, everything else pales in comparison. But I think even, moving forward and he's doing well and things are good. I think it's still, it's grounding and I think it's humbling to just to always have that, hold that perspective and go back to it, regularly.
That's great. That's so great because, I mean, I know you agree that the hardest things in life are the things that kind of force us to grow the most and become who we're meant to be. And like you say, we might not choose them, but if we can look for the good and I love your point about, just noticing and paying attention and being appreciative, I guess, of the small things. And I feel like that's where joy is found in motherhood in general, is when we can notice all the small good moments in between all the, messy, hard, tired moments.
Yes.
Yeah, that's a really good advice.
Yes, for sure. And especially, with, little things, kind of little victories are, with kids like this, they're even more meaningful. So it's even, more cause for celebration and just the, as much as like the, the tough emotions, as hard as those can be, I think with the, the positive emotions, they're just so much more, amplified and, you experience them on a different, a greater level. So that's a really, obviously wonderful thing.
That's great. So there is beauty to be found amidst all the challenges.
Yes, for sure. For sure. Yes.
Well, thank you so much, Dr. Erin Joyce, for being here to talk to us today about this. And everybody, you can find her on her website, drerinjoyce.com. Any last bit of wisdom you want to share?
I think just, I think just the importance of, being kind of kind to yourself as the mom, as the parent, and, recognizing that, there are going to be ups and downs and, but just, kind of knowing that you're going to be okay and, and just focusing on your kid and yourself and, and there's support out there. So
that's good. Keep looking till you find it, right?
Yes.
Good. Well, thank you so much, Erin, for being here with me today.
Thank you so much for having me. I really It's been a pleasure.
Me too. And for everybody out there, I hope you'll visit drerinjoyce.com to learn more about Erin and all that she does. And, you can get in touch with her that way if you have any questions or anything about what we're talking about. And
Definitely.
That's great. Okay, good. And so until next time, everybody, continue to grow through motherhood. No matter what your challenges are, it's a lot better to grow through them than to just go through them. And it's a whole lot more fun to do it together as we do each week here on Motherhood Radio. So I will see you next time. Everybody have a great week. Bye-bye.